Welcome to This Explainer. Okay, today we're tackling a topic that honestly is usually shrouded in stigma, embarrassment, and fear. We're going to break down a really terrifying physical blockage known as fecal impaction. I know, this isn't exactly dinner table conversation. But as focused learners, we don't shy away from the mechanics of the human body. We're going to set aside all that embarrassment right now and look at this with a structured, compassionate, and scientific lens. Because understanding what's actually happening inside you is the very first step to fixing it.
Okay, let's dive into this. We've got a clear, step-by-step roadmap to help you navigate this medical crisis. We'll quickly cover the silent bathroom struggle, anatomy of a blockage, entering the danger zone, a 4-step emergency action plan, and finally, long-term prevention strategies.
So, let's start with part 1, the silent bathroom struggle. You know, this condition really thrives in isolation. Because of the incredible stigma around our digestive health, people end up suffering in absolute silence behind closed bathroom doors. Let's talk about the exhausting, painful reality of this situation. Have you ever found yourself sitting there, feeling this incredibly heavy pressure, pushing with literally everything you have, only to realize absolutely nothing is happening? No matter how hard you strain, it feels like trying to shove a solid brick through a tiny keyhole, and it simply won't budge. You get exhausted, you give up, and then you try again hours later, only to face the exact same frustrating reality. If you're nodding your head right now, just take a deep breath. You aren't imagining things, and you are definitely not alone. In clinical terms, this whole nightmare is known as a fecal impaction. But let's strip away the medical jargon for a second, right? This isn't just your run-of-the-mill constipation. What you're dealing with here is a very real, serious physical blockage. It's a severely dehydrated, incredibly hard mass of stool that has essentially trapped itself, getting tightly wedged inside your rectal cavity. Moving right along to part 2, anatomy of a blockage. Now that we know what it is, we really need to look at the physiological mechanics. One of the biggest misconceptions out there is that a blockage of this magnitude just happens out of nowhere. It doesn't. This situation never forms overnight. Actually, it's the climax of a slow buildup. What often happens is, on days 1 through 3, you might think you're having regular bowel movements, but you aren't completely emptying. A little bit of waste gets left behind. Now remember, the primary job of your large intestine is to absorb water. So by days 4 and 5, as that leftover stool just sits there, the intestine continuously drains its moisture. By day 6 or 7, wow. It's lost all its water and transforms from a normal, soft consistency into something that physically resembles a dry, heavy stone. And this brilliantly illustrates the mechanical failure happening inside the body. Think of your lower digestive tract like a narrow rubber pipe. That pipe is beautifully designed to stretch and move soft, pliable materials. But when it's suddenly faced with a solid, jagged rock, the pipe stretches to its absolute maximum capacity and just gets stuck. The rock won't compress, so no matter how much downward pressure you apply by straining, the mass is just too large and too solid. In fact, pushing harder actually compresses that rock further into the rubber pipe, maxing out its stretch capacity even more and making the blockage incredibly painful. Which brings us to section 3, entering the danger zone. We need to elevate the stakes here for a minute, because a fecal impaction is not just a frustrating inconvenience. It is a genuine medical emergency that sends some very confusing, fast-moving ripple effects across your entire pelvic region. Let's look at one of the biggest red flags, which is honestly highly counterintuitive: overflow diarrhea. You might suddenly experience watery liquid stool leaking out, leading you to think, well, I definitely don't have a blockage, maybe it's just a stomach bug. But what's actually happening is that rock-hard mass is completely blocking the exit, and new liquid waste from higher up is squeezing and seeping around the edges of that solid stone. Listen very carefully to this warning from the source material. Do not take over-the-counter antidiarrheal medications. Doing that will only paralyze your digestive tract further and make the rock-hard impaction significantly worse. Another hidden symptom involves your bladder. You might find it incredibly difficult to pee, or maybe you feel a constant urgent need, but only pass a few painful drops. Why? Well, it's just basic human anatomy. Your rectum and your bladder share a very confined space inside your pelvis. When your rectum is distended to its absolute limit with a giant rock, it physically bulges out and compresses the bladder right in front of it. In severe cases, people literally end up in the ER needing a urinary catheter simply because their pinched bladder is forcefully shut by the stool blockage. But the dangers go far beyond that. The ultimate life-threatening worst-case scenario here is bowel perforation.
Your intestinal wall is a muscle. When this living tissue is stretched way beyond its capacity for days on end, its blood supply gets severely compromised, leading to a complete intestinal obstruction. The extreme internal pressure and friction can physically tear the intestinal wall. If that happens, toxic waste spills directly into your abdominal cavity, resulting in a massive, life-threatening infection. So yeah, you absolutely cannot just wait for this to pass. All right, let's get into Section 4, the 4-step emergency action plan.
Now, let's slow down the pacing a bit. We're going to walk through a very deliberate, precise, and rigid emergency protocol to safely rescue your body. But before we get to the solution, let's establish the critical ground rules of what not to do. First off, let's just strip away the shame right now. Do not panic, and please do not be embarrassed. Second, you must stop aggressively straining and pushing. You're only hurting your internal tissues and causing severe swelling. As we just discussed, absolutely no antidiarrheals. And finally, when you do start treatment, do not immediately run to the toilet. We'll explain why in a second.
Okay, here's the progression. Step 1 is an at-home intervention using 3 suppositories. Step 2, if Step 1 fails, involves resting for an hour and then repeating Step 1. Step 3 means it's time to head to the ER for a clinical-grade enema, or intestinal lavage, where professionals use proper tools and fluid volumes to break the mass apart. And Step 4 is the absolute final medical resort, manual extraction. Let's be totally transparent about this. If the mass is cemented in there, a specialist has to physically go in, break up the stone manually, and pull it out. Because the tissue is usually incredibly inflamed by this point, this is often done in an operating room under deep sedation or spinal anesthesia. Let's look a little closer at that at-home intervention. So the crucial point is getting this specific technique exactly right. You need 3 adult glycerin suppositories all at the exact same time. Lie down on your side. This takes the downward gravity off your pelvis. You must heavily lubricate them with a safe water-based lubricant because, remember, the mass inside is bone dry. Insert them deeply alongside the mass. And then, here's the most important rule of the whole shebang. Wait. Stay lying down for a minimum of 30 minutes. The glycerin needs time to physically melt at body temperature, coat the rock, and intensely lubricate the walls. Do not rush to the toilet after 5 minutes or you're just going to push out an unmelted suppository.
Finally, let's look at Section 5, long-term prevention strategies. Once that emergency blockage is finally cleared, the relief is indescribable. But remember, surviving the extraction is really just winning a single battle. If you go right back to your old habits, this painful nightmare is absolutely going to recur. We have to win the war here. The source material gives a really great warning on this. Stimulant laxatives are your false friends. Over-the-counter stimulant laxatives might offer a super quick fix, but they actively ruin your natural digestive rhythm. They chemically irritate the intestines, basically forcing them to contract unnaturally. Over time, this creates a completely lazy, addicted bowel. If you stop taking them, your body literally forgets how to push waste out on its own. No way we want that. Now, as part of our objective look at this source material, it's worth noting a promotional pitch that's included in the text. The source actually promotes a specific daily supplement. They describe it as an 8,000-year-old underwater gut superfood. Via a QR code, they claim this specific supplement can soothe the gut and clear up to 10 pounds of toxic waste without relying on restrictive diets, harsh medications, or even eating mountains of fiber. We're just reporting what the source proposes here as their solution to clear residual waste, so you have the full picture. But moving back to the structured medical advice provided, true long-term management is a science. It really requires building a sustainable, tailored protocol. First off, you must prioritize deep hydration, as water is literally the only thing that keeps waste soft. You have to analyze your daily physical movement and manage your dietary fiber intake. You also need to physically retrain your body to use the bathroom at a consistent time every single day. And above all, seek professional medical guidance from a digestive health specialist to build a plan that's perfectly tailored to you. The overarching message from the source is incredibly vital. Please do not suffer in silence. Do not let embarrassment stop you from getting the help you desperately need. Countless people suffer from this terrifying issue behind closed doors. If you found this structured explainer helpful, please share this information. It might just be the exact emergency guide someone you care about needs right now.
Let's leave it on this really fascinating note. We've seen how just a few days of dehydration and incomplete digestion can physically alter the state of your lower anatomy. It really makes you think about the mechanics of your own body, doesn't it? So ask yourself today, are your daily habits, your hydration, your movement, your routines, setting you up for smooth sailing? Or are you silently building a blockage? Stay hydrated, listen to your body, and keep learning.